हमने पास्ट में देखा कि पॉप स्टार जस्टिन बीबर को एक बहुत ही स्ट्रेंज डिजीज हुई और इस डिजीज का नाम था रैम्से हंट सिंड्रोम। बिलीवर्स काफी चिंतित थे, लेकिन आखिर में डिजीज होती क्या है?
The symptoms of Ramsay Hunt syndrome typically are inability to close one side of the eye, tinnitus, loss of taste sensation, and vesicular eruptions which are on the one side of the face. And sometimes it can also have imbalance and hearing problems. Ramsay Hunt syndrome basically is because of the virus which is called as varicella zoster virus. So those people who get infected with varicella chickenpox, which is again caused by varicella zoster virus, it then becomes dormant in our body. So whenever there is reduction in the immunity or some stress on the body, these viruses get reactivated, and this can be a presentation of a reactivation of a virus. The treatment for Ramsay Hunt syndrome is antiviral drugs and painkillers. Also, short course of steroid needs to be given. Mostly people, almost 70% people who have Ramsay Hunt syndrome, if they take adequate treatment, they usually recover very well. It's a very interesting question. Bell's palsy is basically caused by herpes simplex virus, and Ramsay Hunt syndrome is caused by varicella zoster virus. So both these viruses are from the same herpes families. In Bell's palsy, there is only weakness of one side of the face and there is no rash. But in Ramsay Hunt syndrome, there is involvement of reddish rash which has some vesicular character. In Ramsay Hunt syndrome, almost 70% of the people who receive steroids, antivirals and some supportive analgesic medications and adequate physiotherapy, they usually do well. However, there will be few people who will be left with the long-term complications. This will include a facial paralysis which does not completely improve. Second is they tend to have a post-herpetic neuralgia, where once the inflammation of the nerve settles down, they tend to have some burning sensation, altered sensation along the distribution of that nerve. Sometimes, very rarely, they can have residual hearing problems as well. Ramsay Hunt syndrome as such is not contagious. However, if somebody has not had chickenpox in the past and they have lower immunity, like they are on chronic kidney medications or on medications for cancer, who have low immunity, if they come in contact with a Ramsay Hunt patient, before the rash gets healed, they definitely have a higher chance of acquiring an infection in the form of chickenpox. So it is advisable that high-risk patients who have lower immunity do not come in contact with such patients, or they have a vaccination for the same.